Yeah, good morning, everyone. I am Dr. Aniruddha Mahindrakar from Mumbai. I have no financial disclosures. So, though glued intraocular lens and newer methods have come up significantly, however, still sutured scleral fixation of intraocular lens remains the gold standard. Scleral fixated sutured intraocular lens is a very important procedure, and here we have called it the standard SFIL. Standard SFIL procedure is mostly lengthy. Shortening it will definitely improve the results by reducing the tissue trauma and also increasing patient comfort. So the aim of the study is to compare surgical time of modified sutured scleral fixation of intraocular lens with this standard technique. In the methods, the conjunctival and scleral flaps are made 180 degrees apart, similar to the standard method, along with vitrectomy wherever necessary. The straight needle in the tenoprolene is passed under the scleral flaps through the scleral blade, similar to the standard method. However, here it is docked in the 26G needle through the main wound, unlike the standard method where the 26G needle comes from the 180 degrees opposite scleral bed. After the needle is brought through the main wound, it is passed through the eyelet of the intraocular lens. The needle itself, it's docked again in the 26G needle, which has been passed under the same scleral flap, and the suture is tied there. Similar steps are performed on the other side, whereas in the standard method, the two sutures, there are double pass, and the two sutures which are in the anterior chamber are pulled out of the main wound, cut, and then they are passed through the eyelets and tied to each of the eyelets of the haptic. So this is the photograph wherein we have passed, this is the operative photograph wherein we have passed the needle through the scleral bed out of the main wound. And then this needle is passed through the eyelets of the haptic, and it is passed twice so that it does not lose. There is no knot which is tied there. Then the needle is passed again through the main wound and docked into this 26 gauge needle, which is coming from the same scleral bed. So we have to be careful that the going haptic, which is going on the right side, should be the curved question mark one. Also, while we are going inside, we have to be careful that we are not taking a bite of the scleral or the corneal flaps there. So our study was 25 eyes of 23 patients. 12 eyes had undergone the standard method and 13 had undergone the modified method. Male to female ratio was 11 to 13. Post-operatively, all standard post-op follow-up care was done by a single surgeon in the same outpatient setup. Routine slit lamp, intraocular pressure, visual acuity, and fundus examination, as well as the post-op medicines were standard and similar. None of the patients selected had diabetes or hypertension. The average age was 59 years, and all surgeries were performed by the same surgeon in the same setup. A follow-up of 6 months was performed. The time required for the standard technique was approximately, on an average, 37.5, that is 37 minutes 30 seconds, and for modified method it was 24 minutes. Thus, the surgical time was reduced by approximately 13.5 minutes compared to the standard scleral fixation steps by the same surgeon. So we can see a significant reduction in the surgical time. The intraocular pressure changes were similar in both groups. Corneal edema was slightly more in the standard group compared to the modified group, but not statistically significant. So post-operatively, all the scleral fixated eyes were, both groups were well-centered and stable. There was not significant difference in the corneal edema, as we said, or inflammatory reaction between the two groups. However, the modified method does surely shorten the surgical time. However, both the procedures are actually equally good. However, shorter time will in turn definitely lead to reduced tissue trauma, and this will further improve the surgical outcome. However, we will need more studies. So the limitations were a very small sample size. Also, the duration follow-up was short, and it was a non-randomized nor a double-blind controlled study. So in conclusion, a simple modification in the surgical steps helps in reducing the surgical time, which in turn helps in reducing the surgical trauma and hopefully improving the results. References, and thank you.
Thank you, doctor. Do we have any questions for him? Yeah, any questions for the doctor?
Only one suggestion is he could have shown a short video
Yes,
during
sir.
the presentation that would have, helped us
Correct.
see the procedure.
Thanks for the suggestion, sir.